I'm Dr. Batal, and I will discuss how I do arm sculpting differently. Arm liposuction is frequently done in this country. However, the vast majorities of the surgeons and the centers that offer it target the lower part of the arms, this part, that often contain a good amount of fat and a bit of a hanging skin. However, the majority of the centers ignore the rest of the arms for various reasons. Either the surgeons are not comfortable with the anatomy, or they're not trained to do this, or they do not want to spend extra time. However, often the lateral part of the arm is what's causing the fullness, or it's what's causing the unpleasant appearance of the arm. In my practice, I am one of the very few practices in the US that does perform liposuction 360 circumferential arm sculpting via liposuction and skin tightening. I use safe lipo technique by hydrodissecting the fat via the tumescent fluid, using multiple entrance points throughout the circumference of the arm to target every single fat cell in the arm. This technique, along with the micro-air power-assisted liposuction, produces the highest amount of fat harvest of any arms. The average fat harvest from the arm is usually between 150 to 300. My average is usually between 450 to 900, so more than like 2 doubles and a half. I delineate the muscle anatomy of the arms by maximizing the liposuction along the grooves between the muscle, especially the deltoid, the biceps, and the triceps, and the brachioradialis, and the brachialis. And all this will provide a high definition appearance of the arms. After we do all the liposuction all across, I do helium plasma skin tightening, and the helium plasma does contract the fibroseptal network between the skin and the fascia and decrease it to allow the skin to better glove the arm. This could save about some patients who could be candidate for an arm lift, not all of them obviously, but I have a great success. I often also ask the patient if they have any fullness in the axillary area, which is the crescent-shaped fullness in the underarm. I mandate it in some cases just to produce a normal appearance. Of all the surgeons I know, I'm the only surgeon who does perform circumferential sculpting of the arms, and with almost 1/3 of the price of other groups in the East Coast. Our average cost is about $4,000 to $5,000, including the sedation and maybe a couple of extra thousand if you want to do the axilla. Please check out my work and I will be happy to help.